Our hyoid bone is a little different than the rest of our bones in our skull. This small U-shaped bone is found in the upper anterior neck. It's our only bone that doesn't articulate with any others. There's no joint where it connects bone to bone. The function for our hyoid bone is to be a movable base for the tongue. Muscles attach the mandible to the hyoid bone, and the base of the tongue attaches to it as well. This small bone, when you see it on the lab practical, it's only about 2-3 inches across. Our tiniest bones, though, are going to be in our ears. We have 3 tiny little bones that transmit vibrations. They're located in the middle ear, so even if you poke a Q-tip down into your ear, you should not be able to touch them. The malleus is going to be the hammer, the incus is the anvil, and the stapes is the stirrup. And these tiny little bones transmit vibrations and allow you to hear. We'll learn more about them on the special senses chapter a little further on. Your vertebral column is composed of 26 bones. This is where I mentioned that we start having bones that just have numbers instead of names. Luckily, we don't have individual names for each of these. The function of your vertebral column is to provide vertical support for the body and also house and protect the spinal cord. It is divided up into 3 sections. The topmost and smallest section is going to be the cervical. These bones only have to support the weight of the head, and they have to be kind of flexible so you can turn your head from side to side. So they're pretty small. As you go down to the chest, we have the thoracic vertebrae. The thoracic vertebrae are all of the ones that are connecting to your rib cage, protecting all your abdominal organs, and they're holding your arms and shoulders, so a little more weight, and they're bigger. But your lumbar, those are your big ones. The lumbar are in your lower back, and they hold up all your upper body weight. So they're much heavier, squatter, and thicker than those upper ones. Looking at all of those differences allows us to identify where in the vertebral column a bone is located. It also has a lot of features on the vertebrae itself. We learn about these in labs, so I won't ask you about these on the exam. Here's a picture showing a cervical on the left, a thoracic with its V-shaped spine that goes down, and a big, heavy, short, squat lumbar that holds up most of your body weight. Once again, we're going to need to know these for lab, but in lecture, we're just breezing by real quick. At the end of your vertebral column, basically at your butt, these bones start to fuse together. You have 5 bones that fuse together to form the sacrum, and then you have the tiny little tailbone of 4 bones that are very, very small and fuse together to form the coccyx. Whenever you're first born, you have a C-shaped spine curvature. That means that your spine basically curves in a big C whenever you're in that fetal position. Initially, babies won't be able to lift their head and control it by themselves. But once their muscles begin to develop and they get a little older, they begin to develop a cervical curvature that allows them to lift their head up. So your cervical curvature forms at 4 months after birth, allowing the head to lift. And it just basically curves the opposite direction of that original C-shaped fetal position curve. The thoracic stays the same. And then the lumbar curve is that anti-curve that forms 1 year after birth, allowing that baby to stand and walk. The sacral curve stays the same as the original. Occasionally, there can be an abnormal curvature where the curvature becomes extreme. Kyphosis is an exaggerated thoracic curvature that results in a hunchback appearance. Now, this could be caused by a disease, it could be inherited. Osteoporosis can contribute to this, and certain cancers. Another curvature is lordosis. This is an exaggerated lumbar curvature, often called a swayback. When this becomes very extreme, it can become difficult to walk. Scoliosis is an abnormal lateral curvature. It's the most common curvature deformity. It may have to be corrected using either back braces or, if it's very extreme, surgery with stabilization of the spine to get it back in that mostly vertical position. We've made it to the thoracic cage. This is the rib cage plus the sternum. It's a protective enclosure of your thoracic organs like your heart and your lungs, and it serves as an attachment site for your muscles as well. We have 3 categories for our ribs. We have true ribs that connect to the sternum by their individual separate cartilage, false ribs that share cartilage, and floating ribs that have no connection to the sternum. Here we can see in teal turquoise, those first 7 are all the true ribs. If you'll notice, they each have their own piece of cartilage that connects the rib to the sternum. Once we get down to the purple false ribs, 8, 9, 10, those all share one piece of cartilage when it joins together and heads towards the sternum. The floating ribs, 11 and 12, have no cartilage attaching them to the sternum at all. The sternum is the breastbone. It forms the very center. If you were to feel your neck and then go down 2-3 inches, you're feeling the start of the sternum. That's your breastbone. The manubrium is the topmost portion that articulates with the clavicle, those little bones that go out to the side towards your shoulder. The body of the sternum is the majority of it, and it's where all of those rib cartilages or costal cartilages connect. And that tiny xiphoid process is the very bottom of the sternum. This was interesting when I first heard about it. If you were looking at a body that you found and say it was buried 100 years ago, and there was a round, small hole in the sternum, you were trying to find out the cause of death of this individual, and you thought, well, could they have been shot? It's a little round hole about the size of a bullet. Maybe they got shot in the sternum, and that killed them. But it was he wasn't jagged around the edges. It obviously was natural looking. It turns out that sometimes a sternum will fail to fuse. When it is forming, it should all fuse and form one complete bone surface, but in some cases, it leaves a little hole. Now, you might never know that you have a little hole in your sternum unless you had an x-ray or something to look for it. You might only find it whenever someone is a body in a skeleton. Moving on to our pectoral girdles. The pectoral girdle is going to connect the spine to the upper limbs. The pectoral girdle attaches the axial skeleton, or your spine, to the upper limbs. It consists of the clavicle, which is your collarbone right there in front, and the scapula, your shoulder blade, on the posterior side on your back. The upper limbs consist of the humerus bone, the upper arm. Your lower arm, your forearm, consists of the radius and the ulna. Your wrist is formed from 8 carpal bones. Your palm is 5 metacarpal bones. And phalanges are the bones of your fingers. There's 14 of those. Here's some more pictures of the humerus on the left, the radius and the ulna in the middle, and then your carpal, metacarpal, and phalange bones in your hand on the right. And these are, once again, something that we're learning very well in lab, so we just really breeze on by in this one. If you know someone who's older, it's very likely that they might have arthritis. Arthritis is joint inflammation. It affects millions of Americans, mostly women. When there is inflammation of the joint, it can actually destroy a lot of the cartilage that's going to help that joint move smoothly. And if too much destruction and scar tissue forms, it will immobilize the joint, locking it into a specific position, making them unable to use their fingers or hands. The pelvic girdle is the girdle that attaches your axial skeleton to your lower limbs. It consists of two hip bones, also called coxal bones, a left and a right coxal bone. Here we can see the sacrum forming the backside, and from the sacrum on the left and the right side, it connects to the coxal bones. And then right in front is the pubic symphysis that holds those bones together in front. Each coxal bone is going to be formed by the fusion of three bones: the ilium, the ischium, and the pubis. These three bones form three different sections of that coxal bone. The bones that form the lower limbs are the femur, which is your thigh bone, your patella, little tiny kneecap on front. The tibia is your shin bone, this is larger. The tibia is the larger leg bone, it's called the shin bone as well. And then the fibula is a small lateral leg bone. Here we can see another view of the femur and also the tibia and the fibula. Going down, your ankle consists of 7 tarsal bones, 5 metatarsals, which form the sole of the foot, and your toes consist of 14 phalanges, just like your fingers. When your body is forming, there are circumstances where something can happen during fetal development, either due to genetics, medication, drugs, just plain chance, and one of the limbs may fail to form. These limb malformations can vary from missing a finger to having toes that are still stuck together to a whole limb failing to form. Amelia is complete absence of a limb. There will typically be a bud or a place where it would have started growing, but nothing is there. There's either no leg or there's no arm, and it just stops at the shoulder or the pelvis. Maybe during development, blood circulation was somehow not supplied to that limb and it just didn't develop at all. Phocomelia is a severely underdeveloped limb. So parts of it are there, but like in this example, the hand was formed, but the forearm and the upper arm did not form properly or just severely underdeveloped. Once again, these can be genetics, medication, drugs, just chance of something not forming right. Polydactyly is when an extra digit is there. Maybe the cells that were going to that area to form a digit somehow split and formed 2 cells that were both intended to become fingers. We see this in cats sometimes where they have multiple toes, where they have multiple extra toes. Poly means many, so polydactyly means many fingers or many digits. Poly is our word for many. Ectrodactyly is when there's a missing digit or a split or cleft. With the hand, it's possible for right in the middle between your 2 left fingers and 2 right fingers that a cleft or a split could appear. And this can really change the appearance of the hand. And that concludes Chapter 8. For Exam 2, we just have one more chapter to go.